Well, coffee drinkers got a jolt of good news Wednesday from the World Health Organization. See what I did there? 25 years after classifying coffee as possibly carcinogenic, the organization now says the beloved beverage may actually be beneficial to our collective health, albeit with a catch. CBS News medical contributor Dr. Phillips is here to explain the latest findings here. If you do this for a living, and if you do it in the mornings for a living, we become inured to a degree to the coffee's good, coffee's bad, coffee's good, coffee's bad. So what is it?
I do. I understand how people feel a little bit cloyed or jaded by the changing headlines every day. But that's what big meta-analyses, big studies like this do. So, years ago, 1991, the World Health Organization added coffee to a list of substances that were possibly carcinogenic, based on a link to possible bladder cancer. Now, 25 years later, thousands and thousands of studies later, they convened a group, 23 scientists, to look at more than 1,000 very high-quality studies and finally draw some conclusions, right? Each individual study, there is no study, no matter how compelling it is, that's powerful. It's only powerful if you can reproduce it over and over and over. So that's what they did here. They looked at all of these studies and finally said we can draw some conclusions. We can say moderate coffee drinking probably isn't harmful and may have benefits, including lowering your risk of heart disease, lowering the risk of diabetes, delaying the onset of some neurologic illnesses, including Alzheimer's, and decreasing your risk of certain cancers. So they can say that definitively, not based on one study, based on thousands.
Moderate consumption, which it's about as relative a term, I suppose, as any in existence, is
Very
what?
Much so. So the same group that worked on the dietary guidelines, updating them last year, defined moderate consumption as between 3 and 5 cups a day. Not 3 and 5 venti mocha chocolates. That's not what we're talking about. We're talking about between 3 to 5 small cups, like the way
mug.
We never kind of drink it anymore. The small with the little saucer, 6 to 8 ounces.
Millennials are saying, what are you talking about?
What is that? What is this cup and saucer?
Thimblefulls of coffee. We mentioned the catch. Researchers say, so maybe the coffee isn't cancerous, but it might all along have been the degree, literally, at which we were drinking it.
Sure. Well, one of the risks that they did say, they said it is probably hot beverages, meaning beverages that you drink regularly that are over 149 degrees Fahrenheit, are probably carcinogenic specifically to esophageal cancer. Basically, if you burn your esophagus every day, even a small amount, that damages the tissues and may in fact cause cells to become cancerous.
For those of us without liquid thermometers.
Right. You don't put a thermometer in yours every morning?
149 degrees Fahrenheit. Sounds awfully hot. Is it scalding? I mean, what are we talking about?
It's very common, right? When you look at, the chain stores where you get coffee in the morning or where you pick up tea, it's actually very common for beverages to be served, or even soups at 160 degrees. Tea seems to be served the hottest of all, sometimes up to 170 degrees. But what I like about this is it's a possible link, but a really quick fix. All you got to do is let it cool off.
Let it cool off.
I mean, if you drink it and you feel like your tongue is burning, you feel like your throat is burning, it probably is.
All right.
So let it cool off and you can get rid of that risk.
I know I speak for virtually everyone in this profession when I say 1,000 thank yous, Dr.
I'm cheering too.
Thanks so much.
Great to be here.